Welcome to the Doc Style Reps podcast, where we talk with medical device sales reps about how they got started, how to support docs, and tales from the OR. If you're interested in asking a question on the show, please email info@docstyle.com.
Welcome to the Doc Style podcast. I'm your host, Nate Darling. There is so much more to surgical devices than just the implementation and the selling and all of those relationships. There is the big picture that needs to be seen, and behind every big picture is an executive. And we're very lucky to be talking to Steve Haayen, who is the Vice President of Commercial Operations for Astura Medical. Welcome to the Doc Style podcast, Steve. How are you?
Hey, I'm great. Thank you, Nate. Thanks for having me.
So, Steve, let's start by getting right into the basics of it. How did you get started in the industry, and why specifically did you get into medical?
Yeah, no, good question. I initially coming out of college, I wasn't quite sure what was up or down, but I knew I had an opportunity to get into pharmaceuticals. So it took the first job that came to me that made sense, and it opened up a whole new world. I got to learn about the pharmaceutical industry, which then in turn piqued my curiosity to look outside of that, and ultimately through some networking and meeting with others in that industry, doing my diligence, found medical devices and more specifically spine. And so that was an interest that got piqued to hopefully make an impact both personally and professionally on a number of different people, patients, surgeons, and everyone else that falls within the kind of the scope of medical devices.
Okay, so the interest is piqued. You've got an idea of where you want to go. How did you get into the industry specifically?
So it specifically came through a recruiter. And to take a step back from that, as I transitioned and moved to Southern California from Ohio at the time, some of the first people that I got introduced to as I began to network as I moved out there were working for Medtronic and working in medical devices, and specifically in spine. As I got to understand what they were doing and the opportunity and the challenge that came with it, I began to network through them, through others, and ultimately was introduced to a couple of different executive recruiters who were kind enough to take me on as someone and felt that I had some value to bring to an organization, and ultimately was recruited and landed a role through that avenue, going through the recruiters.
Getting into medical device sales doesn't come without its challenges. However, it has become much more accessible than it was a decade ago. If you're interested in pursuing this career, make sure to get connected on social media with platforms like LinkedIn, medreps.com, and medical device recruiters. Nowadays, there is even a medical sales college that has campuses across the nation, and it focuses on orthopedic trauma, reconstruction, sports medicine, and the spine. Many times you can reach out to folks that are in the field and schedule an informational interview that can help broaden your understanding. Where there's a will, there's a way.
And your first job that you landed, what was that initial experience like for you?
It was phenomenal. It was a unique opportunity because I was fortunate enough to have two different opportunities pop up at the time. One as a regular rep, if you will, coming in, having a territory, and then also another role where it was an associate position where I felt I was better suited to come in and really learn the business from the ground up. I was fortunate enough to be under kind of the mentoring of a group that had been in the industry for quite some time, had a base of business, and allowed me to really learn from the ground up what it meant to be, what a privilege it was to be in the OR, how to handle myself, not just in the hospital setting, but how to appropriately prepare for the OR and how to sell within that environment. So it was eye-opening to me, and really gave me an introduction to what medical devices and more specifically spine was all about. It's as competitive a market space as I've been fortunate enough to be a part of. So my competitive nature was piqued and absolutely loved it.
Now, what did you learn in that first job?
So I think more than anything else, it was how to appropriately be prepared at all times. And you think you're prepared, but thinking option A, option B, and option C at all times. And if something goes wrong, God forbid something does go wrong, what is your out? How do you ensure that no matter what scenario, as much as you can control that setting by the appropriate preparation and having the right things there and understanding what the game plan is interoperatively, that you take the initiative to ensure that all those things are in place. So you set the surgery up, set the surgeon, the patient, everybody involved up for success for your portion of that case. So it was preparation before, and then the appropriate follow-up after to make sure you learn from each one of those surgeries to be better next time.
By failing to prepare, you are preparing to fail. A very important part of being a device rep is preparation. Create a pattern for yourself, a systematic approach to your daily activities. Be sure to check your devices and instrumentation regularly. And when preparing for surgery, make sure you understand the possible challenges that may arise. Have prepared contingency plans in case things don't go as expected.
Now, how did those experiences in that first job get you to the next step?
Yeah, it was interesting in the role that I initially took on as an associate rep. I was fortunate enough to earn an opportunity to take on a territory, and within that, a lot of those same skills and in the preparation and the other things were immediately applicable. And I think the same approach to running a territory and trying to cultivate business and grow a business, and those things proved to be a blueprint for success. And that's something that I like to pride myself on, is that I feel like we are, always prepared for as best we can be for the different scenarios and thinking ahead, thinking for all the different aspects of whatever the business might be. If it's in the OR, if it's on a sales call, if it's, managing the things that are in front of us, inventory, whatever those things may be, that we are thinking and prepared for as many different possible, solutions and scenarios as we can, or scenarios and having solutions for those instances.
Fantastic. Now let's jump into your current role. What is it like working for Astura Medical?
It's interesting. I'm having as much, if not more, fun in this role than I have in my entire career, and I think it's really attributed to where we are as an organization, because we're doing some things differently. There's always going to be challenges that come with any role, but where we are right now, we're in a hyper growth state, one of the fastest growing companies in spine today. And so, we are different in a lot of ways, in the ability to work with our team to do things the right way from start to finish, but also build something unique has been a lot of fun. So, but like I said, those are all things, and they all come with their own unique challenges, but they're all challenges that we love taking on, because we're having a good time doing it and building a really a great culture and a great environment around that.
Now, aside from what you just mentioned, what are some of the really good things about working for your current company?
Well, I think we have a unique model as compared to a lot of different companies out there, and I think that it comes first and foremost with we found a niche in the market as Astura that is unique. We're bringing best in class technology to independent distributors, and as the market's laid out today, that was a void that we really felt was not truly filled with. And the way that the marketplace is drawn up today, you have the large companies that are in this space who come out with a lot of great technologies, but there are a lot of other niche companies throughout there, but no one who's really been able to pull all of that together and bring that technology in a full bag that can compete with the high-end companies and bring that technology to independent distributors and to surgeons. And we're doing that, and I think that model has proven itself out by our growth year over year over year now.
Astura Medical was formed in 2014 with the objective of creating a disciplined, multifaceted approach to developing, manufacturing, and distributing medical devices. With surgeon input and feedback at every stage of development, Astura has created an extensive line of devices of the highest quality and sleekest design. The two essential pillars that contribute to Astura Medical's success are high-quality products and robust distribution channels. These pillars, combined with passion and innovation, are what drive the Astura team to achieve great success with developing devices and entering them into the spinal implant marketplace.
And what are some of the challenges that you've had to overcome as a company in that process?
Yeah, I think, the biggest challenge for us nowadays is, and we're coming out of, coming into this next realm and next year as we continue to get bigger, but is the hospital contracting and approval process is much different today than it was, 15 years or so ago, or even 5 years ago, as it relates to being able to get new technology and quality technology into hospital systems. With more and more hospital systems becoming consolidated and pricing continuing to be driven down and the number of vendors being limited, it creates new challenges that we haven't necessarily seen as we did. It was fairly open a while back, but now that is easily the biggest hurdle that we have. And as we become more of a household name and more people are introduced to our technology and our instrumentation and value that we bring as an organization, it really stands out that, some of those barriers are being removed for us, but it's still a challenge we take on almost daily.
Now, what would you have changed about your actions, or are you just comfortable saying, everything that I've done so far has been the best decision we could have made?
No, we're very self-aware as an organization. We don't pretend to have all the answers to every single problem or scenario that comes our way. But that being said, I wouldn't have changed anything for me personally, and I necessarily wouldn't change anything for our organization. And that, we're learning constantly, and and it's for Astura as an organization or for myself, anytime we encounter some of these problems, I don't necessarily look at it as a bad thing. We learn from them, we become better, and we continue to evolve from there. So all of those decisions and the things that we've done have been able to get us to the place that we are today. And because of that, I wouldn't look back with 2020 vision saying, or in hindsight here, saying that we would have made big changes in this way or that. We're learning and continuing to get better, and that's what's driven us to this point so far.
All right, so let's look at your day-to-day. What is your day-to-day like in your current role?
That's a great question, because in our current state, it's a lot of different things. We're still, although we are one of the fastest growing companies in spine, we are still on the smaller side. So it's everything from negotiating hospital contracts to working with our current distribution channel to managing our marketing communications, to writing press releases, to putting water bottles in the fridge. So it's truly all over the place. And I think it's an approach that we all as an organization try to contribute in our own way. And I think going back to it, I think that's one of the unique things about Astura today is that we're all able to make contributions, and everybody's willing to dig in and help. So it's not have people who are just punching a clock. Everybody here is very passionate about what we do and believes in the organization and believes what we're building here. So, but to go back to your initial question, it's a whole lot of different things at this point.
Now, what would you say is the most challenging part of your current role?
I would say the most challenging part for my current role is similar to what I was saying just a few moments ago. It's really negotiating with hospitals and hospital contracts and getting through the approval process. That is one of the biggest challenges that we run into day in, day out. And as we get more of those approvals, then we're able to open up our technology, which we believe to be, and has been validated by surgeons to be truly best in class and best for their patients. And that's the biggest thing we try to remove. And once that's there, we've seen our technology kind of win out time and time again.
And what's next for you and Astura Medical?
For us, next is, we have a full slate of new products that are going to be hitting the market, pending 510K approval. We'll be getting in over the next 3 to 6 months. We'll be launching our lateral platform. We'll be launching our anterior lumbar platform, as well as our integrated plate and spacer technology for cervical, anterior cervical as well. In addition to bringing on additional inventory to support what's already been validated in the market between our expandable lumbar cages, our MIS system. There's a lot that is ahead for us in the next, like I said, 3 to 6 months, much less the next 12 to 18 months. We're also going to be launching some of our professional education this year, hosting trainings for surgeons and distributors. And now we are fully operational out of our Dallas office, where we've gone from just over 10,000 square feet in San Diego to launching our and really functioning out of our Dallas office, where we're now at almost 40,000 square feet on the number. So that's been a big undertaking and an exciting one that we're in the midst of.
If you are persistent, you will get it. And if you're consistent, you will keep it. We previously mentioned how important preparation is to being a successful medical device rep, but it's just as important to be consistent.
Fantastic. Now let's turn a little bit and take a look at some of the keys to supporting the docs. Now, what is the key to being a good rep?
I think it's two things. I think, it's consistency. It's showing up day after day after day. And doing it, when I say consistent, it's performing at a high level. And with that comes something we mentioned earlier about preparation, is by the time you get to surgery, a lot of the work is already done. It's running through the different scenarios, understanding your specific instrumentation and your implants, understanding the procedure. It's like anything else that you do. The preparation and the process of being ready is one of the biggest aspects of it. And then by the time you get to to surgery, if you've been given that opportunity by a surgeon and or hospital to be in the OR and given that privilege, if you've done the right preparation, those things traditionally go well, even in the midst of a more difficult or complex surgery. If you've studied up and done the things you need, you'll have success. And if you can prove yourself in the OR, that is where you can bring the most value. There's a lot of additional things, building relationships in and out of the OR that are important. But if you have that trust equity built up with your customer base in the OR, that is where I believe that you will see that success over time.
Now, do you prefer service or product when you're selling?
For me personally, and specific to spine, I think the technology is critical. The service I can control, that's within my scope or within our rep's scope, how they service an account. So that's a controllable they have. If you have and couple that with best-in-class technology, that's a very kind of dangerous and lethal combination if you want to go out and be successful. That's the type of thing that will drive high levels of success.
And what do you think is the key to a long career in device sales?
I think it's an ability to continue to learn, be committed to your craft, and that you don't know what you don't know, and even to the point that if you think you know, or then you can never learn, right? If you think you understand it, even as well as you might believe that, there's always room to grow. Nobody's perfect. Nobody's going to get it right 100% of the time, and no one has all of the knowledge that's out there and available to you. So I think one of the keys is a willingness to stay humble and continue to, be a master of your craft, understand the different procedures, and even within that, become more proficient in each and every one of those. I think the second thing is also being aware of the rest of the market. What are the trends? What are your competitors doing? What technologies are on the forefront? What are some that may be coming back around? That there's always something there that you can be learning and being better at. I think additionally, being prepared is always a key piece of it. As I've highlighted a couple times, that's a big piece of the puzzle. And those are the biggest things, and not afraid to fail. I mean, you go in, you're, like I said, no one is going to get it right 100% of the time, but as long as you learn from those opportunities that may not go exactly as you planned, and maybe it didn't go your direction for whatever reason, learning from that opportunity and being better on the other side, that's the biggest piece.
Please remember, strong customer relationships drive sales, sustainability, and growth. Tom Cates.
Okay, so turning to relationships a little bit, how do you engage with a new doctor?
I think you have to do your homework on the front side, right? To understand what is that individual, what is important, what is important as someone who is hyper-focused on a specific technology. Are they passionate about an approach? Are they passionate about something above and beyond medicine, and finding a way to connect and hit on that common ground so you have an opportunity to even begin to engage? Those are the types of things of, once again, going back to preparation, that are so key. I think as you have those opportunities, that's to really build a relationship. That's how you do it, is making sure you understand your customer and what's important to them, and then building the relationship from there.
Now, moving on, how do you engage with an existing relationship with a doctor?
Well, I think one, you continue to build on it, and one of the best ways as a rep to build on that is performing at a high level in the OR. Right? If you're in there and you're not prepared, if you're not bringing value in the OR, understanding your instrumentation, understanding the implants, understanding even the workings of the hospital, how you can be a resource even above and beyond what you may just be bringing, I think is the biggest piece with existing customers, and ensuring that you can continue with success, and understanding what is important to them, because it can be a fluid situation. What's important to your customer today may not be what's important to your customer 12 months from now, much less 2 weeks from now. So I think it's staying in constant open communication with them, making sure, checking in that they're feeling like they're getting the support and the things that they need to be successful as well.
And what about a new company that you might be working with? How do you engage with them?
So expand on that question, if you don't mind, a little bit. When you say company, what does that mean? Does that mean a hospital? Does that mean a surgeon practice? Does that mean a distributor? Can you please expand on that question?
Let's go with the distributor for this. How would you engage with a new distributor that you might be looking to work with?
I think the main thing is understanding where they are in their business, and the same thing that with a surgeon, what is it that they are looking for? If we have an opportunity to have a conversation, it's really understanding, what does their business look like today? What are some areas where maybe they feel comfortable that, hey, they're doing pretty well, but maybe there's a little room for improvement? Is that on technology? Is that on support from the company? Is that opportunities? Maybe they have a surgeon who is looking to teach because that's something they're passionate about. It's just understanding as much of that situation and for them on what they need and what they're looking for. Because if you can bring value to those specific needs, that's where you begin to additionally drive, value, where you'll engage in a relationship that could be meaningful. And I think the other thing that we do is also make sure that we outline what success looks like within our model as well, because we have some general ways that we like to operate in a partnership, very open, honest, ways that we go about our business that we demand a little bit more out of our distributors than some other companies, but at the same time, it allows for if we set the expectations the right way out of the gate, it proves out to be a much better partnership long term for both parties.
The hospital environment is changing, and many of the decisions regarding medical devices are coming from large and national contracts or the C-level suite. It is important to keep your finger on the pulse in a hospital and understand the approval process for new devices. The way you service the hospital might be your differentiator.
Now, turning down to hospitals, how do you manage the relationships there?
I think it's two ways. One, on the initial engagement, is making sure that as we initiate an agreement, that it's terms that both parties are happy and comfortable with, because I think that sets the foundation for a long-term partnership that will be successful. Inevitably, there'll be bumps along the way, but that's the best way to get off on the right foot. And then additionally, supporting it with our distribution partners on a local level who are there day in and day out to making sure that they are, once again, doing their job, and we're supporting them as best as possible, because that will, once again, build a more productive partnership for the long term. And as they go in these life cycles of contracting and some of the consolidation, if we're doing our job correctly and providing good support, good technology, those things seem to build the types of relationships that will last for quite some time.
Now, what advice would you give people who are looking to break into device sales? I think
two things. I think one is be authentic to yourself, because that's what people are going to buy into. And be it a company, be it a surgeon, be others, be authentic, be who you are. Second piece I would say is always go in with an open mindset and willingness to learn. And obviously, the last and most important piece is go in. You're going to have a lot of grit. You're going to get a lot of no's. That sales, it's even harder in medical devices, and specifically around spine, where there's 400 plus companies within our market who are all competing for a piece of the revenue. So there's going to be a whole lot of no's, a whole lot of challenges along the way. But as long as you're willing to learn and continue to put in the work, success will get there. It will find you.
If you are your authentic self, you have no competition. Success is no accident. Instead, it is hard work, perseverance, learning, studying, sacrifice, and most of all, loving what you do.
And to wrap up this part of the interview, what does the future look like for device sales as a whole? For example, do you see risk or do you see opportunity?
I think it depends on how you look at it. I think, there are a lot of things and some models that have tried to eliminate the rep in the room, if you will, or even the distributor, and as a margin save, an ability to try and maximize revenue at a hospital level. But what I would say is that for the folks who are really good, the distributors and the reps that are bringing real value in these complex spine cases day in, day out, making sure that everything is there in every possible scenario, even when things are going wrong or could potentially go wrong, that they're there to save that situation. I truly believe there will be a place for those folks for the foreseeable future. If you're an individual who's in the room just counting numbers, not putting in the work, not putting in the right preparation, the other things that are required, there is a risk, I think, involved for those individuals. But if you're bringing real value to the hospitals and the surgeons day in, day out, I don't believe that's a position that's going to be eliminated anytime soon.
Fantastic. All right. So we just have the speed round left. We've gone through the hard, heavy lifting. The first question in our speed round for you, Steve, and I'm going to pause this because I've got a monitor graphic here that just went dark for a second. All right. It's time for our,
no worries.
No worries. It's time for the speed round. So these are just some quick questions, quick answers. Do you consider your success related to hard work or luck?
hard work, and I would attribute it a step further a little bit of both. Hard work, I think, tends to breed luck. You can to a certain extent create your own luck. So I would say more hard work than anything.
And what career would you have chosen if not for device?
Great question. I would have to say something in public relations. I enjoy the writing and marketing, and I would probably say something in PR.
What's your favorite influencer, book, or speaker for this industry?
I would say Ryan Holiday is my favorite author and probably the biggest influencer. He's outside of medical specifically, but a lot of the themes in the books and the content that he puts out are applicable to what we do day in and day out, and also on a personal level. I think it rings true both personally and professionally.
Now, do you have a favorite medical facility that you have supported?
That's a great question. I would say there's probably two. One is here in San Diego at Alvarado Hospital, and that's probably nearest and dearest to me because that's really where I spent and really grew the most professionally as a rep. Spent a lot of nights, days, holidays in the facility, and there's a lot of great people who've worked there, both surgeons and employees. So I would say there for sure.
And finally, some quick advice you would give to someone that's trying to get into the device sales industry.
I think go in with an open mind and a willingness to learn. And if you open yourself up that way, I think coupled with hard work and all the right preparation, I truly believe there's probably a spot out there. And be willing to take something if you're coming from another industry and you feel as though you need to go directly into being a rep. I think there's a lot of value from learning the business and the industry from the ground up. So don't be afraid to maybe take a step back in order for the long-term gain of learning the industry the right way and building a career in this space, because it can be unbelievably beneficial long-term for you.
That's all I have for today. Thanks again, Steve Haayen, the Vice President of Commercial Operations for Astura Medical, for joining me on today's Docs Dial podcast.
Thanks so much, Nate. I appreciate it.
You have a good day.
Have a great day.
Thanks for listening to today's episode of the Docs Dial Reps podcast. Stay tuned for more episodes each month featuring how to get started in medical sales and tales from the OR. If you have questions or topic suggestions for the show, please email info@docsdial.com. That's info@docsdial.com. Let us know what you think.